Hello, everyone, and welcome to another exciting version of Chip Talks Health. Today, I'm super excited to have Brianna here with us from Toothpillow. We're going to talk about some really interesting stuff. We're going to talk about nasal versus mouth breathing and the health impacts of that, which are profound and way larger than you think they are. So get ready. This is going to be a fun show. And welcome, Brianna, to the show. Glad to have you.
Thank you for having me. I'm so excited to be here. I think I'm gonna get to take some new learning home with me as well.
Very good. Awesome. Yeah, we'll dive down some rabbit holes for sure. And you never know how this is going to go since we're recording it, and you never know where the conversation's going to go. But how did you get started in this, and how you might describe a little bit about kind of what you guys are doing, but then also how you got interested and how you got involved.
Yeah, so I've worked in dentistry for 14 years.
Oh.
And yeah, and so I've been working in dentistry and alongside I had lost my mom to sleep apnea and a slew of health problems. And it was just kind of
Oh
serendipitous
man.
that a few months after that happened, I started working for this company called Vivos that works with patients with sleep apnea with dental appliances. And so all of a sudden, I'm listening to these lectures and I'm seeing before and afters, and I'm like, oh my gosh, that's my mom. Like that's her mouth. And I'm learning this correlation of the jaw size, sleep apnea, and this whole body health relationship. And I was hooked. I was like, I need to be all in on this. And so I was working with that company and I met some of the most incredible physicians and dentists on this mission to, rid the world of sleep apnea. And a big focus is starting with these kids. And so many of them have been doing this for decades in their practice, but they all realize, there's not enough of us out here. And there's families having to drive hours to come see us. So they kind of all came together and created Toothpillow, which is a platform. It's kind of like our virtual dental office that's making this treatment more affordable and more accessible to families.
And the actual treatment itself is like an oral appliance, right? That you almost like a mouth guard. Would that be a proper description?
Yeah, for sure. And it's one piece of the puzzle. So there's three main components of treatment. The first one is helping families establish good nasal breathing, and that includes nasal hygiene, which is a term that was like new to me, nasal hygiene. But helping families understand tips and tricks and why it's important to keep our kids' nose clear. So using like an X clear rinse or something to keep those nasal passages clear. Wearing the guide appliance. So the guide, it's not just one; it's a series, and they kind of grow and graduate to the next phase. But that is a passive device. So they're passively activating all of the facial muscles and tongue posture at night. And then the third piece of it is myofunctional therapy, which I'm not sure. Have you heard of, or are you familiar with myofunctional therapy? Um, it's essentially I don't like to call it this because I feel like it minimizes it, but it's easy for parents to grasp, like yoga for your face or physical therapy for your face.
Okay.
Yep. So a lot of the young kids call it mewing. That's kind of what they like to call it. And that's the active part. So we passively are engaging all these muscles, and then we're actively engaging them and training our tongue where to live, how to swallow properly, and how to keep our nasal breathing.
So how many kids do you think could benefit from this? I mean, you guys see this as a large
Epidemic.
problem, right? Yeah. So what
Huge.
percentage would you say suffer, and then how many kids could really benefit from this?
So we call a child that doesn't need us a unicorn. We don't see it anymore. So find me a child that has great primary spacing, meaning big gaps in between all their baby teeth. How we know they have good spacing, we can stick a nickel in between every baby tooth. If you can do that, that tells us that child is adequate growth for their age. And they're not symptomatic, meaning they're not struggling from chronic tonsils and adenoids issues, grinding their teeth, bedwetting, ADHD behaviors, and we can talk about how all that connects. So a non-symptomatic child with beautiful primary spacing, it's an epidemic. You can't find those anymore. And how you can look at that as an adult, find me an adult who grew into all 32 of their teeth, meaning their wisdom teeth. They did not need them removed, and they did not need braces. If you can find me one of those, it's just as rare. And that's because we know that child with the beautiful spacing grows up to have plenty of room for all their teeth to come in easily. And if you have a big, beautiful arch, you can breathe well. And if you can breathe well, you have less symptoms. And we like to say, if you look at the anthropology, if you look at, our ancestors' skulls, they have big, beautiful jaws with all 32 teeth, and they didn't have braces. So we know it's our Western culture that has interfered how we're growing. And now we have an epidemic of underdeveloped children on our hands that grow up to underdeveloped adults that are sick.
So what are you seeing as kind of, let's say, the underlying cause of this narrowing or difference in the jaw? Because clearly we weren't always this way. So what do
Yeah.
you think? Is it genetics? Is it food? Is it behavior?
It's a lot of factors, but one of the first one is in the introduction to our Western diet, our soft food diet. So if you look at, there's some like Inuit tribes in Alaska that are pretty untouched by modern culture today. They don't have blenders, they don't have purees, and they're giving their babies right away things to start gnawing on and chewing on, and they have to start working those muscles. So the tongue and the facial muscles are what grow the face. So we want our tongue from infancy on to be up in the palate and suction and putting pressure to help grow and develop. And also establishing really good breastfeeding and prolonged breastfeeding. That's the first introduction to working all of these muscles and establishing that, and then going straight to a hard food diet to continue to work and develop those muscles. And we just don't see it anymore today. Even myself, yeah, I have two boys, and of course, I wanted to breastfeed them, but I had to go back to work, and things happen. And we introduced pacifiers and bottles and a soft food diet. We're giving them puffs and purees, and it's just going down. They're not having to work for their food and grow those muscles. And so, and we also have a lot of unaddressed tongue ties nowadays too, kiddos with tongue ties that were never addressed. And if the tongue is tied down and it can't get up in the roof of that palate to do its job, the palate's just going to grow at a slower rate than it's supposed to. And then it becomes this domino wheel effect. So this this bone here, is all one bone. So the roof of your mouth is the floor of your sinus.
Hmm.
And if your tongue's not pushing on it to grow and drop that palate down, you'll have what's called a high vaulted palate. So instead of it being like this, it's like this. So it goes up impede your nasal cavity. So when this child is trying to breathe, their body's like, oh, that's not enough oxygen for me. Let's breathe through our mouth. And mouth breathing is rescue breathing. So they open their mouth, start breathing through their mouth, and that little slight hinge of that pool is redirecting the growth. So instead of growing forward and out, they're growing long and down. So we have that longer face that we see.
Does that? I have some. I'm a research scientist, and I'm also kind of a
Yeah.
free thinker, and always am diving down weird, strange rabbit holes. But I've studied the olfactory, system and olfactory bulb quite a bit. Would this impact, let's say, the cavity
Mhm.
size? Okay, that's fascinating. Yeah.
We'll see. There's two things we'll see, and I'm gonna do my best to describe this, but I can send you some videos of Dr. Ben doing it because he does such a better job. But another symptom we see in these kiddos is venous pooling under their eyes,
Yeah.
because when it's not growing, it can't drain properly. So we'll see like the shiners under their eyes. And then we also see I believe it's the sclera, where they have more whites under the eye showing when when they're not developing properly.
Interesting, interesting. Well, what like if you could talk to, let's say, an open-minded parent, so hopefully we're got
Yes.
some open-minded parents listening to us, what would you say to them? I mean, about like, what's it sounds like it's a very high probability that this is impacting their
Mhm.
child, but are there like physical things that they could see as far as how their child breathes when they're sleeping or things like that that would be warning signs for, gosh, that you're getting kind of to a severe level?
Yes, and Dr. Ben says it so beautifully that some of these warning signs are stage one of this disease. And then if we're left untreated, we're going to get to stage four, which is sleep apnea. So he says if you see these early signs, this is when you want to act, especially kiddos are so moldable and we can do so much when they're still growing. But the closer they get to 12 and puberty, it gets harder to move things. So symptoms and signs I would look for in your child: dark circles under the eyes, um, no primary spacing, so no space in their baby teeth. So if all their baby teeth are touching, or even worse, nowadays we see crooked baby teeth, which is mind blowing. That's a big sign. Um, if they're having chronic ear infection, so and I'll quickly explain the reason
Oh,
behind that.
okay.
So if a tongue is not swallow so the eustachian tube in the ear only drains with a proper swallow because it makes a vacuum seal that drains it. Our tongue should go up and back, and there's a proper way to swallow, believe it or not. And we have so many kids that have an improper swallow, and their tongue is not trained to do it correctly, so they're swallowing a lot of air, but they're also not making that vacuum to drain their ear, and they'll have chronic
Ear
ear infection.
infections.
As an adult, I had my tongue tie released in my functional therapy as an adult. The first time I swallowed after my release, my ears, I felt that pull because I had never been able to do it. And it was very cool to feel that now my tongue is swallowing properly. Chronic issues with their tonsils and adenoids. So when we breathe through our nose, the air is humidified, filtered, warmed, and it goes down and delivers to our lung the way it's supposed to. But when we don't have the space here to breathe and get enough oxygen through our nose and we breathe through our mouth, it's going right back to our tonsils and adenoids. And so that can be a sign. Chronic cavities. I think we were chatting before it was recorded, so I'll repeat just in case. But if a child is mouth breathing during the day and especially all at night, it's just drying out that saliva. And saliva is our protective coating that's going to help us protect from cavities. And if that's missing, you're going to be chasing cavities forever because no amount of flossing and perfect diet can combat the lack of saliva
It, it,
protective
it,
barrier.
I was shocked when I started just poking around at like the difference between mouth and nasal breathing and infection, because that's always kind
Mhm.
of how I view the world. I view all disease, really, or most disease, as just some kind of infection. And if we can kind of understand those infections and treat those infections, and we can cure most disease. But they always have a genesis and a reason, and it's been mystifying to me why we can't defend ourselves, right? So why our immune system isn't strong enough to prevent like a helminth, a parasitic infection. Well, it turns out if you kind of start pulling some threads, IgA and your mucosal layer, so your saliva layer, so to speak, super important in how you defend yourself against these parasites. And it's looking now like, again, if you're a mouth breather, you're going to dry out your mouth. That increases pH. That's going to dry out your stomach. That's going to increase pH in your stomach. That's going to slow down stomach acid. And it just makes you a sitting duck to get infected with not just dental caries, but I'm talking, strep, candida, a lot of stuff we see in autism. Is this associated with autism, by the way?
So I don't know, and I would have the doctor speak to that, but I do know like tongue ties and the MF with that gene mutation, and that's yeah,
MTHFR.
there you go.
Yeah.
That's all connected, and a tongue tie will lead to underdeveloped jaw. So There's probably some type of connection there, but I can absolutely get that answered from one of our doctors and send over to you.
Yeah.
And I was going to mention something. Oh, ADHD and behavioral problems. So that I can speak to, and there is absolutely correlation there. So when we're breathing through our mouth, we are putting our body in fight or flight all night. So I'm going to
Oh,
use my example of my little boy. Um, so he had his tongue could not stay at the roof of his mouth like it's supposed to at night. So what does it do? It falls back. And when a tongue falls back into your throat at night, you're going to have apneic events. You're not going to get enough oxygen. So before we started treatment for him, I would wake him up in the morning. He's twisted in the sheets. He's on the floor. He's sweating. He looked like he was wrestling a bear all night. And so
mm,
what's happening is he's not getting good oxygen. So his body's saying, roll over, move, like get me in a better position. We're not like, they don't know, what's going on. So his body's trying to help him. And so he's staying in fight or flight all night long, and he's not ever dipping into REM, restorative sleep. So the next morning he's waking up tired, and he's going to school, and he's struggling with his behaviors because he's exhausted. He slept 10 hours, but he didn't get 10
sleep.
quality hours. Right. So he was struggling with his behavioral issues. I think of like when you're postpartum, like when I had a brand new baby, like things that typically don't make me cry were things that don't typically upset me were upsetting me because I was sleep deprived. There's a really great study by Karen Bonnick that shows that 50% of children with sleep apnea or OSA also have an ADHD diagnosis because, and if you take sleep deprived symptoms and you compare them to a child with ADHD, they're identical. And so a lot of our doctors are so passionate about if a child is getting on medications and getting these diagnoses, they absolutely need a sleep study. And in her office, she believes that 50% number is actually higher because any child that walks through her door that says they have ADHD, she sleep studies them. And in her office, it's almost 100%. They always have some type of sleep disorder breathing. You get that fixed, and then that goes away. And instead of having to put a child on these medications. So for my son, we got him in Toothpillow, we got him doing his exercises. And by the 6 week mark, I can remember it like it was yesterday, walking into his room. He's at the head of the bed. He's breathing quietly through his nose. He's fully covered, and he looks like he was in the deepest sleep he's ever had. And he woke up easier. And now the teacher's like, "What's changed? He's doing great." And like he just transformed, all
Wow.
because he was not getting sleep. And had I not known what I had known, I would have been pushed into that traditional, like, well, like, I think it's time we have that conversation. Rowan's not sit. And I just know there's so many children out there that are in that situation.
Yeah, it's fascinating because again, if you go back and this is what I do as a researcher, but I'll go back and look at, where were we in the 1800s? Where were we in 1850? And we were a lot better off. We had a lot better, handle on a lot of these problems. We didn't have a lot, we didn't have kids, tweaked out on cortisol and ADHD, and we didn't have a lot of the disease problems that we have right now. So it's really interesting. And, I think to your point, it goes back to indigenous peoples understood this and understood basically how to develop the jaw and the importance of the jaw. And they did it, by behavior and food type thing, no Gerbers and no pacifiers, right? In indigenous
Exactly.
peoples. Yeah, no, this is really, really interesting. So will you walk me through kind of, let's say I have a child who I'm concerned about and I call Toothpillow, what are you going to recommend and kind of what are the steps? Give me kind of the treatment. And then also I want to know for an adult, like if I feel like I'm a
Yeah.
mouth breather as an adult, are there things that Toothpillow can help me with?
Yeah, sure. So if you have a child between the ages of 3 through 12, a family can go to toothpillow.com and submit online. So that's the best part of it all. You can just submit 6 photos, answer a questionnaire, and submit online. And then what happens once you do that, it will go to Dr. Ben, and he will do the first screening on that child to see if they are approved for virtual care or if they really need in person care. So We do have to unfortunately deny about 30% of patients because they're so severe. We need to help match them with an in-person doctor, and we will help. We will help navigate you to the closest provider that we know and trust is going to take great care of your child. But if they are approved for virtual care, it'll then go to their state provider, where they'll do a video assessment of that child. So the doctor will record themselves telling you everything they see about the symptoms and how they're related. Anything dentally that they see, they'll let them know, and that will be sent over to mom and dad and who are caretakers, and they can then decide if they want to start treatment after having that. And with your code that we were able to give you, it's free of charge. So, I mean,
Wow.
just such a beautiful, yeah, like
Yeah.
please don't please take advantage of that because it's just a 10-minute video that will of your child, and it's going to give you so much knowledge even if you don't move forward with Toothpillow, or it's going to give you a lot of insight in what we're seeing. And then if they do get started, it's a 2-year program. So for 2 years, they'll be overseen by the doctor. Everything that is needed to be successful to, reestablish nasal breathing and redirect that growth in the muscles is all included in there. And then for adults, we do have teens and adults coming soon, hopefully launching before the end of the year. But we always say, don't wait on us because time is of the essence. Like, if you're having these issues, just send us an email. We will help find you somebody. So even for yourself, if I can find out what state you're in and all that good stuff, I will help match you with an incredible provider. Uh, for adults, everyone asks, is it too late for me as an adult? It's not too late. It's just now harder. It's just harder because our bones, our suture has fused, like all of those things. It just gets harder to do it. But there's absolutely things we can do because, like, for example, I mentioned my mom. She was my age when she got diagnosed with OSA or sleep apnea, and she was in her 30s and she looked like me. She just had sleep apnea. She found out because she was falling asleep at work and while driving, so she had a test. She got the traditional CPAP that she barely wore, because we know that those things can be uncomfortable, and because of that, all those years of having that lack of oxygen all night just took a toll on her body. So all the comorbidities started setting in, heart issues, diabetes. They all can be linked back to sleep apnea. And there's a really great study. I wish I can remember what it's called about when we do the time change. Maybe you've heard of it, but there's like a big spike in heart attacks every time
Mhm.
because that loss of hour of sleep. So sleep is just so vital to our health. And so, yeah,
Yeah, we
there's
actually I study that pretty heavily. I mean, we run on, circadian rhythms. So the way that, it's not your mind, it's the way that just your body works. So your body works on
Mhm.
circadian. And when you alter, let's say, the time that you're getting up versus when the sun rises, that super messes things up. And so it's, we're way better off without that change. And it doesn't matter really which way it is, one way or the other. It's just we're better
Yeah.
off without changing that. Um,
The,
so and a quick question, because I know we've got some providers that watch my show.
yeah.
So if I'm a dentist out there and I'm super interested in this, can I become part of the Toothpillow system?
Yeah, absolutely. So, we have, if you email Toothpillow, we can connect you to the right people. And what's really cool is we have many layers that you can participate with us in. You can be a Toothpillow provider, or we can even help navigate you to training so you can just do this on your own in your practice and treat your patients in your communities. So, we have lots of levels of engagement to meet the providers where they're at because we have some that once they learn this they want to go all in and they want to do this in their practice, and then we have some that have other specialties that they're very busy with but they want to offer this to their patients so they can refer them to us too.
Very cool. Very cool. Well,
Yeah,
congratulations on this.
thank you.
And this is a very needed thing, obviously, but the education around this is just super important too. So it's if we can help, with that education, and hopefully doing podcasts helps a little, but if we can
Yes,
help with that education, I'm an advocate. This is really, really fascinating stuff.
that's really where we want to be, is empowering the moms and dads to advocate for their children and to demand this type of treatment because we still have a lot of orthodontic orthodontists out there that are doing extraction and retraction dentistry, meaning they're just taking out teeth and shoving everything back, but we're leaving that palate small and we're pushing everything back into the airway. So, um,
If
yeah,
I
so
lose it, like if I lose a tooth and let's say I have orthodontics to kind of close that gap, that's not helping, right? That's hurting. I need to kind of open that gap. Would that be, and I
open
don't
it.
want
Yeah.
to diss on orthodontists or anything or
Oh,
hurt
no.
anybody's business,
No.
but would that be a fair statement? If I'm closing those gaps, I'm actually hurting my overall mouth versus nasal breathing.
Yeah, you wanna make sure which way we're pulling, right? We wanna be, expanding, and so what's really cool, our bodies are so cool, you'll find this fascinating. I have so much stuff I wanna send you just personally to just keep diving down, but when we expand adults that had their bicuspids removed, which, it's very common, especially your generation, they didn't have the tools they have now, so they just
Right.
had to take out what they called extra teeth, 4 healthy adult teeth to, like, just make some space and then pull everything shut. When we now that we have it, we can expand those adults, and the doctors, they're not dictating where the space is going. They're just doing the expansion right now. But our body always naturally puts that space right where those 4 teeth are, and then they can put implants there to regain that space. It's
Oh,
so cool. It's
yeah.
so cool to see our body just knew there was supposed to be something there, and that's where that space developed. So I have a really great video I can send you where a doctor's showing some case studies that that exact thing happened. So it's like our
No,
body just knows. It knows.
yeah, no, it's just you sent me down a rabbit hole already this morning, but I'll be living in that rabbit hole for a long time because I just, I've been fascinated by why are kids getting so sick now? And it's
Yeah.
obviously because of food, processed food, but there's a bigger picture. You can't tie it all back to food, and infection is part of it. But why are they getting so infected? Our immune system just break over the last 30 years? No, this is a great tie-in and explanation to kind of things I've been looking at already. So I appreciate this discussion very much.
Yeah, I did too. I enjoyed it.
Yeah. So is there anything else that we need to get out there? Obviously, you guys have got a great product. I would encourage everybody to go to your website, check things out,
Yay.
use the code CHIP. You get a free assessment, is what Brianna is saying.
Yeah.
Awesome stuff.
Yeah, no, I think we covered it all. I'm sure as soon as we end, I'll think, oh, I should have added that. But this has been a great discussion. And yeah, thank you so much for having me on. I appreciate getting to use your platform to kind of share about Toothpill.
Yeah, absolutely, and we'll have you back because this is of super
Yeah.
interest to me. So, as you guys develop more studies and all that, it's going to be fascinating just to watch you grow. So, everybody get out there, get on toothpillow.com, use the keyword CHIP. You get a $200 free assessment from Toothpillow, and you're going to save your child a lot of future heartache, headache, and money. Fair enough?
Fair enough. Yep. Perfect. Well said.
All right. All right. Well, we'll leave it there. Thank you, Brianna, so much for being on the
Yeah.
show. And let's definitely stay in touch and follow up. Great stuff.
Yeah, yeah. Right away, I have 2 videos from Dr. Ben and Dr. Zubiak. I wanna send you ones on kids, ones on adults. He is speaking to parents, so it's a little watered down, but it'll spark he put some articles and he did an incredible ADHD study on his it's phenomenal. It's amazing stuff. So I'm gonna send that all over.
Perfect. Very good. Very good.
It was so
All
nice to meet you.
Absolutely. And we'll leave it here for this time. And we'll see you guys back next week with another exciting episode of Chip Talks Health. Bye. Thank you for tuning in to Chip Talks Health, where we uncover the truth so your body can do what it was designed to do, and that's heal. If today's episode helped you think differently about your health, give us a like, subscribe, and share it with someone who needs it. Want to go deeper? Visit TrueMedics.com to explore science-backed solutions, or book a bioresonance scan at Neighborly Wellness to find out the root cause of what's holding you back. Until next time, stay curious, stay well, and keep listening to your body.